Hi everybody, I'm Dr. Britt Talley Daniel MD, a neurologist and headache doctor, and today I'm talking about what are migraine aggravating factors or triggers. Well, many conditions are listed as causing a migraine attack, but this is not exactly true. Why? Because migraine is an inherited genetic familial condition, and the causation of migraine is you're born with it. Also, many of the triggers discussed casually or listed on the internet are really not recognized by migraine experts. So, who would be a good expert or reference for this type of information? How about the International Classification of Headache Disorders, number 3, so-called Bible for Headache? They should know. So, what are the migraine aggravating factors triggers? These are scientifically researched conditions that predispose to developing migraine attack. And these terms require definition. The ICD-10 differentiates between a migraine trigger, which is something that causes an attack within 24 hours, like drinking a glass of red wine, with a migraine developing in minutes after it's consumed, and an aggravating factor like stress, which may take weeks to build up to give you a headache. What are the precipitating, aggravating factors of migraine? And they are the following: psychological factors such as stress, mental strain, fatigue, sleep up too much or too little, endogenous factors like the menstrual cycle, environmental factors such as weather change, temperature change, frequent travels, odors, dietary factors like hunger and alcohol. So, how should individual migraine patients deal with precipitating or aggravating factors in their daily lives? With time and experience, migraine patients need to learn that an attack occurs easily under specific conditions for them. Therefore, migraine attacks may be prevented by avoiding the precipitating or aggravating factors that set off their migraines. It's important that individual patients know what factors precipitate or aggravate their own migraine. What did the authors of ICD-10 find by searching the literature to identify the precipitating or aggravating factors that affect migraine? Well, approximately 75% of migraine patients have some kind of precipitating factor, 3/4. The common migraine precipitating factors are identified in various epidemiologic studies, and they include the following. I've said them before, but I'll say them again now: stress, mental strain, fatigue, sleep, too much, too little, menstrual cycle, weather change, usually barometric pressure drop, temperature change, frequent traveling, odors, hunger, and alcohol. So, does stress have a significant place as a factor for headache? Well, stress is one of the most important, prominent precipitating factors of migraine. Stress triggers migraine in approximately 60% of patients, and 25% of these patients feel the headache occurs when they're relieved from stress, and that's called a let-down headache. Apart from alcohol, the other factors listed above are also precipitating factors of tension-type headache. How strong are sleep issues? Lack of sleep is perceived as the trigger in approximately 30% of migraine attacks. Too much sleep is implicated in 25% of attacks. What about weather issues? Weather is cited as the precipitating factor in 53% of migraine patients. 11% of the patients felt that weather is precipitants in 2/3 of their headache attacks. So if you react to weather, it happens very frequently. What about red wine? Among alcoholic beverages, red wine is a famous precipitating aggravating factor. Histamine is related to pain, and alcohol and polyphenol possess a vasodilating effect, which is probably involved in the precipitating aggravating effect of alcohol. In a study of a group of migraine patients who believed that red wine provoked a migraine and a group who did not believe that, migraine was triggered by red wine only in the group that believed that red wine provoked a migraine. How about that? What about food aggravating migraine? Findings regarding food suggest that the precipitating factors may differ depending on individual patients with migraine. It's been hard to study, it's scientifically not clear. Even from the old days, foods containing amines presented represented as tyramines such as cheese, chocolate, citrus fruits, and nuts, are well known to precipitate migraine. In a survey conducted in England, 16 to 8% of respondents cited chocolate or cheese as precipitating factor. Yet, a double-blind placebo-controlled study in 20 patients who believed that chocolate provoked migraine found that chocolate triggered migraine attacks in many patients. On the other hand, a double-blind study using chocolate and placebo in patients with chronic headache, including migraine, tension-type headache, found no difference in the rate of migraine provocation between chocolate and control, even in patients who believed that chocolate was a precipitating factor. While a large number of foods have been implicated as precipitating or aggravating factors, they do not apply to all patients. Even in the same patient, a given food does not always provoke a headache. And few patients mention specific foods other than alcohol. Therefore, unnecessary dietary restriction may have the opposite effect of lowering patients' quality of life. So in general, we shouldn't do that or advise that as doctors. The American Headache Society publishes views on triggers of migraine on its website. You go there and look around. There was a research study done by Takashima with persons with migraine who consume more fatty oils and foods, coffee, and tea than persons without headache. And from this data, headache doctors are supposed to say that consumption, this is common sense anyway, of a well-balanced diet is recommended. Well, what about migraine and overweight, obesity? Although there's no correlation between overweight and the prevalence of migraine, study has shown that overweight is associated with chronic progression of migraine. Despite recent advances in the treatment of migraine, many patients still do not achieve symptomatic relief. However, even such patients' lifestyle improvements, for example, through sleep and dietary guidance and stress management, may mitigate symptoms, and a maintenance-appropriate weight may help the development of chronification of headaches like chronic migraine. Chabray et al. In 1999, a headache wrote on precipitating factors of headache, and they had a list of things including fatigue and our sleep, stress, food, and our drinks, menstruation, heat and cold weather, and infections. Another interesting article was Kelman writing in Spalgia in 2007 on the triggers or participants of the acute migraine attack, and he listed stress at a frequency rate of 79 and food at 26. His list was as follows: stress, hormones declining from more prevalent to lower levels. Let me do it again. So stress, hormones, not eating, weather, sleep disturbance, perfume or odor, neck pain, lights or flashing lights, glare, alcohol, smoke, sleeping late, heat, food, exercise, and sexual activity. Another observation here is that many patients will focus on different foods that may aggravate migraine and not recognize stress in their lives, which is the most aggravating feature of migraine. I guess one diet is an easy thing to consider and look up and check and avoid, and everybody needs to watch what they eat. But food as a trigger for migraine is not the big issue with migraine attacks. The big issue is stress. Stress concerns personal insight, work or family relationships, time, travel, eating, exercise, faith, getting along. It's a tough series of issues that need to be worked out, sometimes requiring counseling with migraine patients. So thanks for listening and watching. Please click on subscribe down there so we can follow each other. Follow me on YouTube for other migraine talks I have. God bless all you persons with migraine, and I will see you on the next talk.